updates from the Wisconsin and Minnesota governors about efforts to contain the spread of coronavirus. Wisconsin has submitted an application to make the Alliant Energy Center into an alternative care facility to treat COVID-19 patients. Let's go live to Wisconsin Governor Tony Evers.
I'd like to start by saying that I hope everyone who celebrates had a meaningful Easter and Passover. I'm certain that these holidays felt much different than years past. Instead of a house full of family and friends over the holiday weekend, Wisconsinites were sharing meals and making memories online and over the phone. It's another reminder that this virus has impacted our lives in so many ways, but also a testament to our resolve and resilience as Wisconsinites. The last few weeks have been a difficult time for our state. I share with you the sorrow we all feel at the illness and loss of so many of our family members, friends, and neighbors. But I also share with you a sense of optimism that we will get through this together. I remain humbled by the bravery and dedication of our critical workforce, including our healthcare workers, first responders, child care providers, public employees, and grocery store workers. I am inspired by the kids and educators of our state who are adjusting to ever-changing new normals and trying to make the best of a bad situation. Parents, grandparents, and caretakers, I know this is tough on you as well. Our educators are doing a great job, but I know that our kids often need help at home, which can be challenging for those of us working from home. I'm also encouraged by the innovation and kindness of the makers, doers, and givers of our state. We continue to hear about folks stepping up to donate blood, sew masks, and make face shields, and about communities banding together to help one another. Because that's how we will get through this, folks, together. Everyone has to do their part. We're now well into the 4th week of our Safer at Home order. The science tells us that right now, the most effective way we can keep COVID-19 from overwhelming our healthcare system is to continue to practice social distancing so that we can slow the rate of infection. So not only is this the right thing to do from a health and safety standpoint, but it's the only way we will all be able to get back to life as we have known it, as our businesses, our schools, our places of worship, and even with our family and friends. We are starting to see Wisconsin flattening the curve, which means that Safer at Home is working. We talk a lot about flattening the curve. It's a phrase most of us have never heard of up until a few weeks ago. Folks, it's actually pretty simple, and here's what you need to know. When we talk about flattening the curve, we're talking about fewer people getting sick. We're talking about less of an impact on our healthcare systems. We're talking about saving lives. We're talking about your neighbors and coworkers and friends and family. We might even be talking about you. These are the lives we will save if we continue to flatten the curve. This is about more than the number of positive test kits our labs process. We're talking about people, folks who want to attend their kids' graduations or see their grandparents blow out birthday candles or just play a game of euchre with their neighbors tonight. And yes, for now, some of those events may have to happen virtually because we're staying at home and practicing physical distancing. But with Safer at Home, we have fewer infections, fewer confirmed cases, less strain on our health hospital system, and more happy events to celebrate. Because Safer at Home is saving lives and keeping Wisconsin healthier than we would have without it. I'm so thankful for you, Wisconsin, for taking Safer at Home seriously and continuing to protect your friends and family and yourself by following it. I know this goes against the grain for most of us here in Wisconsin, when there's a flood or a fire or a tornado, our natural instinct is to stand side by side and help each other, whether it's filling sandbags or distributing food or clearing debris from the road. This time is different, except for the folks on the front lines. The most help we can give each other is to keep our distance for now. Once the danger of COVID-19 is past, that will change, and we can be with each other safely again. And now I'll turn it over to Secretary Designee Andrea Palm, who will give an update on the important work we're doing to continue rising to the challenges posed by COVID-19.
Thank you, Governor. Good afternoon, everyone, and thanks for joining us again today. In this crisis, we must work together, and just like all of you are working together to stay safer at home, DHS has been working through our State Emergency Operations Center strike teams to respond to our immediate needs and begin to prepare us for the next phase of this response. A lot of very smart people have been putting their heads together to provide us with the data we've needed to make policy decisions. Like the Governor said, our data and our models tell us that the policies are working to flatten the curve. When we hear flatten the curve, we think graphs and lines and color coding and numbers, but we need to remember that the curves on those graphs represent people, and the flat line indicates our hospital capacity. If the people curve isn't below the hospital line, those who need hospital care won't get it. Flattening the curve means we can treat all those who need hospitalization, and it means saving lives. As part of this effort, we've increased the contact tracing capacity of local health departments to follow up with people who have tested positive for COVID-19, making it possible to better track the virus and check in with others who have been potentially exposed. Policies like physical distancing and safer at home have made it possible for our local health departments to increase the percentage of cases they reach with contact tracing and decrease community spread. And we will need to continue to significantly expand our contact tracing capacity to effectively manage this outbreak moving forward. This is another reason that building our lab capacity is so key during this crisis, and we will continue to focus on increasing testing moving forward. In fact, we have 23 active labs running COVID-19 tests in Wisconsin today with a daily lab capacity of 3,886 tests. The more effective our safer at home and physical distancing policies are, the more effective our testing is at reaching people who need it most. And moving forward, our expanding capacity will work hand in hand with our contact tracing efforts to facilitate our ability to actively and aggressively manage this pandemic. And for those with symptoms or who have tested positive, we've opened 2 self-isolation sites and provided guidance and blueprints for local communities to do the same. These facilities will continue to be a critical asset as we further ramp up testing and contact tracing by providing places for safe isolation and quarantine to reduce community spread. While it's not enough, personal protective equipment continues to come in through the PPE donation and buyback program, and that PPE continues to be distributed to first responders. Working with the Army Corps of Engineers and local leaders, we have scouted sites to build out Wisconsin's healthcare system capacity. This will include alternative care facilities on the grounds of the Wisconsin State Fair and at the Alliant Energy Center in Madison. An alternative care site needs staff to run it, and hospitals and clinics across the state will also need more staff during a potential surge in cases. This is why we've launched the Wisconsin Emergency Assistance Volunteer Registry, as Governor Evers announced last week. If you're interested in volunteering, please visit the website weavrwi.org to learn more and to sign up. Wisconsin needs you, and we are so grateful that you will be volunteering. So let's get to our daily numbers update. As of today, we have 36,769 negative tests, which is an increase of 853 over yesterday. We've 1 county reporting cases for the first time. That's Green Lake County. There are now 3,428 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 87 cases over yesterday. I know it can sound discouraging to hear an increase in these numbers, but it is important to know that we have actually seen a decrease in the exponential growth as a result of safer at home. We are flattening the curve. Our number of COVID-19 hospitalizations is 993, which is an increase of 19, and this means that 29% of people who have tested positive for COVID-19 in Wisconsin have been hospitalized. Our total death has now reached 154. We know this is a difficult time for everyone in Wisconsin. It is true that you are safer at home, and it is true that safer at home is saving lives, but that doesn't make it easy. That is why we also have teams working on community resilience, working to provide you with the tools to deal with stress and adversity, and to bounce back from these challenges. If you are looking for tools and resources about dealing with stress, I encourage you to visit resilient.wisconsin.gov to learn more about our Resilient Wisconsin initiative. This is a stressful time, and we need to remember that one way to reduce stress is to reduce our risk of infection. Each of us can do our part to keep ourselves and others healthy and safe by staying safer at home, practicing good health hygiene practices, and following physical distancing guidelines. Thank you for all your hard work, Wisconsin. We are making progress, and working together, we will get through this.
We will now open it up to questions. A reminder to maintain audio quality. Keep phones on mute until it is time to ask your question. In the interest of time, also, please one question per reporter. And we'll begin today with Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. I know this just came out earlier today, but we got to see a draft of the bill that Republicans plan to bring up in the Senate tomorrow, and it sounds like the Assembly draft will be very comparable. I was just curious if the governor has had any time to take a look at that, and if he has any immediate takeaways or thoughts on kind of what's being proposed.
Sorry, I was busy this morning talking to agricultural groups across the state, as well as business officials in the Milwaukee area and other things. So I have not seen it. I saw some preliminary drafts, and so what I'm hopeful for is that we can agree around this package. It's clearly, I mean, if it looks anything like the draft, which I don't know for a fact, but looking at and responding to the draft, there are things we can agree with, and most importantly, having to do with the 1 week, waiving the 1 week, and also the FMAT to make sure that we get the resources we need in the state of Wisconsin. Other than that, I can just tell you, and I guess I would also like to tie my answer into the people I was meeting with this morning virtually. There's an expectation on the part of small business owners and workers in the state, as well as our agricultural community, especially them, that the state of Wisconsin can step up and help them out financially. And so hopefully this will not be a one-shot answer to the crisis here in Wisconsin, but an opportunity to establish a dialogue so that we can talk about the farmers of the state, talk about the importance of small business owners to our state with the hundreds of thousands of people that employ them. But we'll take this, again, I didn't see it. I'm looking forward to seeing it and hopefully coming to some conclusion on these items.
Thank you, Mitchell. Now to Dylan Brogan from Isthmus. Dylan?
Thank you, Governor. Do you believe that voters were disenfranchised in the election last week? And knowing what you know now, would you do anything differently?
I'll answer the last question first, because I'm asked that a lot. I don't know what I could have done differently. The Supreme Court has decided that it was unconstitutional for me unilaterally to do that. I didn't think that was the right decision, but the fact of the matter is that it was made that way. Second of all, if I had done that earlier, the result would have been the same. They would have turned it down 5 weeks before that. So do I think that I succeeded in that effort to delay the election? No, obviously not. Do I think that voters may have been disenfranchised? I don't know that for a fact, but the facts are that I'm sure many people weighed the difference between being unsafe and exposing themselves to an unhealthy environment or voting. Some of them, I'm guessing, did decide not to vote. And if that's a different definition of disenfranchisement, then I guess it is. But as you know, the courts will rule on this in the end analysis.
Thank you, Dylan. Now to Danny Maxwell from WKOW-TV in Madison. Danny? WKOW in Madison.
Yes, this is Emily calling in replacement for Danny for WKOW. Governor, how do you see the state's reputation being impacted now that we are just hours away from the election results coming out?
As it turned out, it was a mess that could have been avoided if the Republican legislature would have joined me in moving that date, but that didn't happen. At the end of the day, this will be resolved in court, and then we can move on. What we need to learn by this, and reputation, that's I dispute that it's going to wreck our reputation. Frankly, I don't know exactly what that would mean. But what we do need to know going forward is, with the benefit of more time, that we can continue to encourage people to vote by mail and make sure that we are able to get ballots out to people in time so that they can return them in time. I think it's pretty simple, and it's clear from at least the evidence that I've seen thus far is that Republicans and Democrats, probably in pretty equal numbers, decided to vote by mail. So I don't think there's any, there shouldn't be much discussion about whether this advantages one party or the other. So we need to learn by the experiences we have, but as far as people not wanting to move to Wisconsin because of this election, I don't think that's a fair assessment.
Thank you, Emily. Now to WISC TV in Madison. WISC. Stephanie Fryer, WISC. And a reminder, *6 to unmute your phone. Okay, we'll move on then to Tajma Hall from NBC 15 in Madison. Tajma.
Hello, thanks for taking my question. This question is for the governor. President Trump tweeted today basically saying that he plans to decide when guidelines for stay-at-home orders will be eased, not individual governors. What's your reaction and take on that?
I don't believe that's an accurate statement.
Is there any
One question,
okay.
Tajma, I'm sorry. We'll move on then to Shali Pittman from WORT Radio. Shali? WORT Radio.
Hi, this is Jonah Chester, filling in for Shali Pittman. Thank you for taking my question. An early draft memo of the proposed GOP COVID-19 response legislation removed civil suits against medical equipment manufacturers that are donating to medical providers. In light of that, what is your administration and DHS doing to ensure proper quality and manufacturing of those PPE and medical assistance equipment?
Well, I'm not sure that's what's in the final draft, so it's hard for me. It seems like a reasonable thing to do to have those benchmarks in place, but not having seen the final bill, I can't respond to that question.
I think I can add a little bit to that too. So in some of the preliminary versions of the draft, the governor's office provided some feedback in order to improve those provisions. In terms of what the state is doing with the equipment stuff that we're purchasing, it's something that we keep a fairly close eye on. One of the challenges that Wisconsin's facing and states around the country are facing in this scramble to get PPE is that there are, people who are selling fraudulent face masks. We're seeing examples of those where they simply stamp N95 on them and they're clearly not N95. And so that is something that we're being very careful about when we're making these purchases. We're making sure that we're protecting Wisconsin taxpayers, and more important, and just as importantly, before we distribute any of that, we're making sure that the equipment is what it says. But, that is one of the reasons why we hope that in this final version of the package that it doesn't protect people who are selling fraudulent products that could harm the public.
Thank you. Now to Robert Chappelle from Madison 365. Robert?
Hi, good afternoon. I want to follow up on, on testing and whether or not the guidelines that have been, last week you talked about sort of broadening the guidelines for who gets tested and whether or not that's had any impact yet in the number of people being tested, and then also is there any plan to start to be even more further broaden the testing, just to get ahead of people who maybe aren't either are asymptomatic or just trying to get a broader sense of the population health using some of those testing protocols.
So I'll let Dr. Westergaard chime in here as well. I think what we're likely to see coming out of the holiday weekend is probably not as many tests as we have seen previously, and I think some of that is probably reflective of the fact that people were celebrating the holidays in this new normal, and did not seek out testing. But I think we continue more broadly, irregardless of the numbers over the weekend, we continue more broadly to want to ramp up our capacity, as well as make sure that we are communicating well with providers about their discretion to order tests when they think that is warranted for a patient that they are that they think needs to be tested. I think we also are very interested in using some targeted capacity to make sure we are wrapping around outbreaks in places like long-term care facilities, assisted living facilities, jails and prisons, and other congregate settings where our ability, again, to sort of wrap around that situation with testing and contact tracing will help us mitigate further spread. And so we're going to press on a number of different channels to build the number of tests more in line with the capacity we have as we continue to ramp capacity here in the state of Wisconsin. I don't know, do you want to add anything to that?
No, I think this assumption that testing might have been lower over the weekend in general is pretty accurate. We've been communicating with healthcare providers and systems that the overall capacity in the state is much higher than it was. I think there still may be regional variability in that, particularly in the non-hospital setting. I think there are some areas where local resources with specimen collection and transport might be a bit of a bottleneck. But I agree with overall your assessment of the strategy that in the healthcare system where we have the resources that we need, and we want to strategically increase how we test in some of these other high priority contexts.
Thank you, Robert. Now to Fox 11 in Green Bay. Fox 11.
Hi, thank you. It's Mark Leland from Fox 11. I was wondering about the numbers. Based on the statistics on your website, it says about 16% of those who have tested positive have been healthcare workers. I think it mentioned 553 cases. With that in mind, what concerns do you have for Wisconsin being able to respond and handle to a surge in cases if and when that happens? And are all the necessary steps being taken to prevent and protect our healthcare workers?
Thank you, Mark. It's a good question. It actually also highlights the fact that this is a new visualization, a new graphic that we started providing today based on interest and really sort of getting to your point, Mark, about the impact on the healthcare workforce and what that means for what we need to do to make sure we have enough healthcare workers in anticipation of potential surge and to continue to treat the folks who need to be treated. I think there are a couple of things that have been going on here in this state that will help us manage this. One is what the governor announced last week, which is this volunteer registry where folks who want to be available in situations where you might have some healthcare workers all from the same location who are sick and you need to replace them with assets from outside that system. This registry can help us pair and match people who are qualified to those kinds of needs. But then also we have done a number of things in the last couple of weeks around licensure and relaxing administrative rules to allow folks, who have retired to come back to pick their license back up. Some interstate reciprocity admin rule flexibilities, and some other things that are really designed to expand the pool of folks who can pitch in and help should a healthcare facility get into a situation where they've got a number of healthcare workers out sick and need us to surge some assets for them.
Thank you, Mark. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, this is Casey Nelson filling in for Rob. Our question is, with just about 100 people being the increase in cases here and there, people are on both ends of the spectrum saying that's a lot or maybe that's not a whole lot. What is really the reality of seeing only about 100 or so confirmed cases every update here?
Yeah, I think it's a great question, and it's an important observation. So the answer is that 100 cases is much better than 1,000 cases that are being seen in other states, but it's probably not low enough for us to feel confident that there's not a fair amount of community spread in multiple areas of the state. So what we've learned from other epidemics in other countries is that when we have a similar testing infrastructure like we do, we probably detect some low percentage, between 10 and 20% of the true cases. So we don't have enough data yet. We will someday when we can scale up some of our other surveillance tools, but we don't know what that proportion is. How big of a tip of the iceberg is it? So what it tells us is that we are have a number of acutely ill patients that have COVID-19 that at this moment is not straining our hospital capacity, but it also unfortunately tells us that there's a sustained transmission in the community. That means that there's a large number of people potentially who are infectious, and that if we relax safer at home, or when we relax safer at home, we're really going to need to be able to zero in and contain those individuals. So it's good news and bad news. Clearly, we're not at the surge that's straining our healthcare system capacity, but we're also not at such a small level that we're safe from having an expanded epidemic like seen in many countries. So we're watching it very closely, and we're one thing that we're certain about is that the level we're at is much better than it would have been projected at the
with Governor
beginning
Tony
when we had
Evers
that
and other Wisconsin leaders. Minnesota Governor Tim Walz is now giving his update via phone. He's expected to announce an extension to the state's emergency declaration. Let's listen in live.
And Budget Commissioner MYRON FRANS and Met Council Chair Charlie ZELLE. As a reminder to reporters, please limit yourselves to one question each with a single on-topic follow-up. And with that, I will hand it over to Governor Tim Walz.
Thank you, Teddy. Good afternoon, everyone, and good afternoon, Minnesotans. Thank you again for joining us. I hope everyone had an opportunity over the Easter weekend and Passover to have time with immediate family, to be reflective on the important things of the family that's around us, and just incredibly grateful for how everyone is handling this and keeping themselves and their neighbors safe. A week ago on Sunday, I gave the very unusual State of the State address from the basement of my residence here, and I used the weather as an illustration, talking about winter. And I think the last few days have also been fairly illustrative of the fight we're in, where it was bright and sunny and warm on Saturday and snowy on Sunday, and a little cold and windy and sunny this morning, and now snowing again. And I think probably the rhythm that we're in and the way that we'll attack COVID-19 is going to be a little bit of that. So while I think there's every reason for us to be optimistic that we have a plan to contain, mitigate, and then be as aggressive as possible tackling this thing and then coming back into our economy, I caution everyone, if you're watching national news and seeing what appears to be a plateauing and good news out of New York State and others, to be cautious that we're just not to the point. It's not just here yet in full force. And our hope is, and our planning and our science behind it, is that we can stop it from being quite as destructive, because we will have the opportunity to take and make changes, especially around the ability to make sure our healthcare facilities and our providers are prepared to deal with it, that we have the proper equipment, from PPE to ventilators to the ICU rooms, and then make strategic plans on what we've learned about COVID-19. And it was just a month ago, 30 days, that we declared the state of emergency. I'm asking to re-up that for 30 days, and asking and interpreting state statute that the legislature certainly needs to make sure that they are comfortable with that and that we are moving together. And we will do that tomorrow to move that forward. But there's some things on here and some things that are being done, and you're going to hear from a few other folks today. One being Met Council Chair Charlie ZELLE is going to talk about what is creative thinking about helping our neighbors. Met Council and our ability, especially around transit and moving people around, critically important to our 7-county metro area. But Metro Mobility is providing free door-to-door service from home to work and from work to home for any person who works in healthcare. I'm proud they're taking this action. They've been out there for weeks now delivering meals to our seniors via the drivers at Metro Mobility. So a big thank you to that team over there. They're also the ones that, when I needed them to, met the plane on the tarmac from the cruise ship to get people back to their homes all across Minnesota. So really grateful there. And, of course, you're going to hear from Commissioner MYRON FRANS that we're obviously watching state budgets very, very closely, looking at how we're using resources to effectively fight this fight against COVID-19. He's going to highlight some of the things that we're doing that we believe make sense, and also some of the things that we know where everybody's tightening their belts, and we've initiated things from hiring freezes to other budgetary management practices that will keep us in a good spot. I've also asked the commissioner to do an extraordinary budget projection. We usually don't do those until November. We're going to ask to get one here in May that will start to assess where we're at, and then, of course, how do we plan afterwards. So Commissioner FRANS will take some of those. Again, as I said, we've extended the peacetime emergency order through May 13th. We believe that we're working in the right directions to save lives. The declaration ensures the state can respond as quickly as possible, so I'm grateful. One thing I'd like to note is that while we're seeing social distancing, and I'll keep continuing to ask folks to not get complacent about that, one of the things is that we've significantly reduced traffic on our roads, but road fatalities are rising. And we know that that we've got folks speeding at this time because there's less cars on the road, and I'm not quite certain why that is. But to date, we've had 76 fatalities compared to 71. So please, watch yourself when you're driving. Please, our state troopers and other first responders and law enforcement don't want to be stopping people all the time. So it's best if I would just ask if we go along and pay close attention to that. And I would also mention we have several other things happening at the same time. Flooding along the Red River Valley up in northwest Minnesota, and flood stage in Oslo is 37.5. And today we're at 37.76, but the good news is that's coming down from 37.91 over the weekend. Our National Guard has been deployed up there for about the last 10 days, and I want to say thank you to them. It looks like maybe by Friday we'll have this thing under control and bring them back off that duty. But I have great respect. I had the privilege of being deployed in 1997 to the Red River floods as part of my National Guard unit, and I know what it means to those communities, and I know what these families are going through giving that service, so thank you for that. And once again, before I turn it over to Jan Malcolm, I just want to remind Minnesotans the purpose of this. The purpose is to save lives. It's to reduce the impact on the most vulnerable. And when I asked for that original emergency action, I asked for it and then the stay-at-home order that we just extended to buy that time. And we thought about it immediately, and I said the way we come out of this, and this is the way we have to do it nationally, is we have to test, and we have to trace, do contact tracing, and we have to isolate the people who need to be isolated. And this has to be on a massive scale. And as I've been talking about now, Minnesota is shifting into that point where you're going to see exponential growth in our testing. We are trying strategies that are not being tried in other places. I am working with other governors. I spoke this morning with Governor Evers and Governor Whitmer, and spoke with Governor Burgum on Friday about thinking regionally, how do we restart our economies together. But the only way that this can happen is that we have widespread testing, permeating testing, both on initial testing and serology testing, that we do contract tracing to continuously isolate folks as immediately as when we find or previous or before hotspots develop, and then isolate folks smartly and keep the capacity in our hospitals there. So our intentions have always been to get to a point where we can push a full court press on it. We're not seeing it nationally. We are not testing nearly widely enough. The PPE situation, just to give you an idea, The average burn rate for PPE before COVID on N95 masks was about 3 to 5 million per month. We need 120 million per month. So when you hear numbers about 5 or even 10 million masks being delivered, it is way, way too small. So here in Minnesota, we're going to think about how do we have to make the swabs ourselves? How is it, what's holding us back on the reagents? What's holding us back on the testing? Because those who want to open this economy, and all of us do, have to know the only way we do it, it has to be in conjunction with the best health advice, the best epidemiological evidence, and that right now is testing, tracing, and isolating. So with that, I'm going to turn to Commissioner Malcolm to update where we're at today.
Thank you, Governor. I will start with the usual data update globally and nationally. The global total as of this morning was more than 1.86 million cases and almost 115,000 deaths around the globe. In the United States, we are just under 560,000 confirmed cases, just over 190,000 in the state of New York, over 103,000 in New York City alone. The United States is now reporting just over 22,000 deaths, almost 7,000 of those in New York City alone. Here in Minnesota, we are today reporting a total of 1,650 cases, which was up 29 more cases from the most recent report total yesterday. I would like to clarify, however, that the numbers the last couple of days due to the holiday weekend are not an apples-to-apples comparison with prior days. On Sunday, we posted on our MDH COVID webpage test results running from Friday evening through 8 p.m. on Saturday, which is not our normal timeline for pulling the data, given that we typically cut off those test results at 4 o'clock the preceding day or the following day's update to the media. So that we had a longer time pull on Saturday, which resulted in a larger number of cases. And then today, the numbers reflect only the additional cases that were confirmed between 8 o'clock Saturday and 4 o'clock Sunday. So to try to make that a little more plain, on Friday, we were reporting 1,427 cases. Saturday, the comparable number would have been 1,536, so an increase of 109 on Saturday. Sunday, and then the update from today would be a total of 1,650 on Sunday, or an additional 114 cases. There have been no new deaths since yesterday's report, so our current death total remains at 70 for the state. So what you see in these numbers, again, is consistent growth, but kind of on the same pace that we've seen, slightly larger numbers each day as the total cases grow, as we expect them to do. As of today, 842 patients have been released from isolation. There are today 157 patients in the hospital, 74 of those in intensive care. I do have Director Chris Erzman on the phone as a resource if you have questions later in the hour. We also appreciate having this opportunity every day to reinforce some key message that's important from what we're seeing on the ground. And today I'd like to talk about personal care assistants for just a moment. We've been getting some questions about the role of personal care assistants, or PCAs, and whether healthcare providers should be allowing them to attend healthcare appointments with their clients. Given the important role that PCAs play in supporting patients, we encourage healthcare organizations to allow home care staff and family caregivers to attend appointments with people who have disabilities or chronic conditions. While MDH and CDC guidance is to limit visitors in these settings, nothing says that an individual with a disability or chronic condition cannot bring a caregiver with them to appointments. Home care staff, such as PCAs and nurses, as well as family caregivers for those who do not receive home health care services, are not just visitors. They're not visitors at all. They work for patients who require personal care and medical care assistance due to their disability and chronic condition. Home care workers have been designated as Tier 1 essential employees by the governor's order and are authorized to go to work. In home care, going to work means going anywhere your client needs to go and are required by law to be physically present with their client at all times in order to be paid. Oftentimes, this means going to medical appointments with their client. So we just wanted to clarify that for our healthcare provider partners, and we thank PCAs around the state for their excellent and vital work. We encourage all providers to ensure that they can do this work for their clients in their facilities. And with that, I will pass it off to Director Kelly at the FEOC.
Thank you, Commissioner, and hello again, Minnesota. I'm happy to report that over the weekend, FEMA approved our request for what we talked about last week, that non-congregate sheltering. And that means we'll have the opportunity to seek reimbursement for providing people affected by COVID-19 with a separate place to live while they go through quarantine and isolation. And this will help reduce further community spread of the virus. This will allow us to provide shelter when someone tests positive or has been exposed to COVID-19 and simply can't go home. As we talked last week, this includes people experiencing homelessness and those who can't return to their usual residence because of the risk of exposing other household members. So we're grateful for FEMA's support and look forward to even more good news soon on our request for crisis counseling program grants. Very quickly, changing gears, and kind of echoes what the governor said earlier, this is Severe Weather Awareness Week, and we were reminded that bad weather is always a threat after communities in Louisiana, Mississippi, and Georgia were hit hard by tornadoes last night that caused significant property damage and a number of fatalities across the southeast part of the country. We live in Minnesota and need to be ready for anything, weather-wise, at any moment. So throughout the week, I'll mention the preparedness theme of the day. Today's focus is on alerts and warnings, including encouragement to get an app that will send a warning to your smartphone if dangerous weather is imminent. It's kind of like having a siren in your pocket. So please visit our website for more information. And with that, I'll turn it over to Commissioner Steve Grove of the Department of Employment and Economic Development. Commissioner Grove.
Thanks, Director Kelly. Good afternoon, everyone. This is Steve Grove from DEED, and I want to share a few updates from the economic analysis we've been doing over time on the impacts of COVID-19. We saw so far 428,203 cumulative unemployment insurance applications from March 16th until yesterday. And, you know, week over week, we've seen those numbers go down a little bit, starting with a peak of 115,000 applications in that first week of March 15th through the 21st. The following 2 weeks, we saw around 109,000 applications, and last week we came in at around 89,000. So we were down about 18% last week over the previous week, and saw an additional 3,943 come in yesterday. So we continue to track those numbers to see how people are taking advantage of that program and making sure we can respond to those applications as soon as possible. The number of applications continue to pour in the sectors that you'd expect. The top 5 sectors remain food preparation and serving, sales and service, healthcare, including both practitioners and support, office and admin support, and production. So we continue to make sure that program is stable, that we get benefits out to people as quickly as possible. Last week, as we mentioned, we were the first state in the country to issue the $600 top-off payments from the Federal CARES Act, and this week we're really honed in on the other 2 elements of that program, the 13-week extension and the ability to provide unemployment insurance to the self-employed or independent contractors, both of which are major lifts and major new extensions and programs for unemployment insurance that the team is hard at work at. We're continuing to work on helping small businesses across the state. Our Small Business Emergency Loan Program, that is, again, a state taxpayer-driven program, has authorized 162 loans, $5.25 million through 11 nonprofits. Those loans are coming from across the state, and once they reach D, we get them turned around within 36 hours. We've built a process that is really built around speed once those applications reach our office so we can get money out to people as quick as possible. And with that, I'm going to turn over to my colleague, Commissioner MYRON FRANS from the Office of Management and Budget. Commissioner FRANS.
Thank you very much, Commissioner Grove. This is MYRON FRANS, Commissioner of Minnesota Management and Budget. You know, we know that the coronavirus is impacting our state's economy, businesses small and large, and also the lives of our family, friends, and neighbors. But we need to put every resource into combating this virus and ensuring that those fighting on the front lines have what they need to do so. But we also need to know the financial impact this is having on our state budget so we can plan appropriately and make modifications where necessary. In anticipation of expected budget challenges due to COVID-19, Minnesota Management Budget is working with Governor Walz and Lieutenant Governor Flanagan to prepare a budget projection plan which does three things. First, Governor Walz has directed MMB to release an updated budget projection in early May based on the latest economic and budget indicators so we have a better understanding of the COVID-19 impact on our state's finances and we can adjust accordingly. Additionally, at that time, we will have or should have received some of the federal funding from the most recent congressional action. Second, effective immediately, we will institute a hiring freeze on all executive branch positions. During the freeze, agencies may not fill any vacant positions and no new positions may be created except for those related to our COVID-19 response. Agencies are also not permitted to use professional technical service contracts or other contracts to circumvent the hiring freeze. The hiring freeze does not prohibit reassignment or redeployment of existing employees, nor does it prohibit hiring for vacancies which must be filled by law. A previous executive order last month has already resulted in a reduction of 1/3 of open positions across the enterprise in our initial partial hiring freeze. And last of all, Governor Walz and his chief of staff and all 24 cabinet commissioners will take a 10% pay cut for the remainder of this year. I will now turn it over to Chair Charlie ZELLE from the Met Council.
Thank you, Commissioner. Hello, everyone. This is Charlie ZELLE, Chair of the Metropolitan Council, which operates Met Transit. As we all know, Met Transit has been providing essential transportation throughout the metropolitan area, but at a much reduced service level. We know that health workers are dependent, many of them, on transit to reach their job, and given the reductions, it hasn't had the access that they previously have had. So, as the governor mentioned, starting today, Metropolitan Mobility is providing free door-to-door service from home to work and work to home for any person who works at a health care facility 24 hours a day, 7 days a week. And, we're able to provide this service because there's an excess capacity afforded by the drop in demand for Metro Mobility services. And has been announced before, because of that excess capacity, we've been delivering groceries directly to the homes of Metro Mobility customers, and actually food from food shelves for anybody identified by the food shelves in need. This new service that we're starting today is going to provide kind of solo or small group, but direct on-demand express routes for these essential healthcare workers. So it really is going to be fairly simple. Healthcare workers need to call our Metro Mobility receptionists or go online. It's at a website under the Metro Council for Metro Mobility Transport for Health Workers. They need to simply provide their employee identification badge, that they're employed by a healthcare facility. This is not just nurses, doctors, but any kind of support personnel for healthcare. So that is part of our innovative idea to continue to get people safely to where they need to go. And right now, healthcare heroes really need a primary protection. Thank you, and with that, I'll turn it back to the governor.
Well, thank you, our Chairman ZELLE. I want to say thank you, and thank you to your drivers who have been out there on the front line, and we're continuing to hear them about getting them the personal protective equipment. But that selfless, compassionate service that they're delivering is really appreciated. With that, operator, we'll open it up for questions.
As a reminder, to ask a question.
You've been watching today's media briefing from Minnesota Governor Tim Walz, including the news that he is working to re-up the peacetime state of emergency in the state for another month. We will continue to track developments this afternoon and bring you updates as they happen on the WDIO website and mobile app, and we'll have the latest on WDIO News at 5. Have a good afternoon.
This has been a WDIO News special.